I'm Victoria Emerton, and welcome to Behind the Design, brought to you by Design in Mental Health, the leading in-person event connecting professionals from around the world who design, create, manage and deliver care in the built environment for mental health care. Design in Mental Health takes place in the UK each June and features a comprehensive programme of presentations, panels and workshops, a free-to-attend exhibition of specialist products and services, and the prestigious Design in Mental Health Awards. For full information on the event dates, the programme details, and to book your event passes, please see the event website, designinmentalhealth.com. Today, I'm delighted to be joined by Santokh Sagoo, Local Security Management Specialist at the Black Country Healthcare Foundation Trust. Welcome to Behind the Design, Santokh, and thank you for your time today.
Hello, Victoria, and thank you for having me.
So Santokh is going to be speaking at Design in Mental Health, and his presentation title is Operation Stonethwaite, and that's what we're going to be talking about today. So could you tell us a bit about Operation Stonethwaite?
Yeah, so Operation Stonethwaite is a West Midlands police initiative that was started about 10 years ago when West Midlands Police recognised that they had a real gap in their processes. So when it comes to reporting incidents from mental health services, so they did a analysis of incidents that were reported by Birmingham and Solihull Mental Health Trust, and they recognised that under 1% of those incidents reported via 101 were getting to any further and receiving a positive outcome, and they recognised that they needed to do some work, so they consulted with their legal teams, consulted with Birmingham and Solihull, and they ring-fenced a detective who would specialise in mental health investigations. And that detective, Karen Barker, who will be joining us at Design in Mental Health in June, was working solely with Birmingham and Solihull for about 8 or 9 years. And in that time, they went from a below 1% success rate to above 25% success rate for all incidents that were reported on 101 to the police receiving a positive outcome.
That's a huge impact, isn't it? You know, to have a tangible impact like that is massive. So why would you say this work is important?
Yeah, so we were contacted by West Midlands Police about three or 4 years ago, and they wanted to roll out this work to other mental health trusts. And when we understood how the process works and the success that they'd had, we were all too keen to get on board with it. And the importance is to bring back that trust and confidence of our staff in inpatient services, outpatient services, for reporting incidents to the police and not being told that the police can't do anything because the offenders have got a mental health diagnosis or they're on an inpatient ward under a section. And it's not just for our staff. Although it's starting with our staff, the hope is that it will extend to patients who are victims of crime on wards, and everybody who's a victim of somebody with a mental health diagnosis where they can be prosecuted, they will be prosecuted.
So staff are hugely important. You know, their working environment for them is it's really important that they feel safe so that they can function effectively. So what difference does this work make to your staff?
So for our staff, it's made them more confident that when they report a crime on 101, it's not going to be filed at source. There's going to be and at least at the very least, if they follow the process through and fill out the forms, there's going to be an investigation by a specialist officer who will look at all the history of the patient, not just the history, not just the single offence. They'll look at the wider details, and then they'll make a prosecuting decision. There is still the legal threshold to get through, so we're not trying to bypass anything with this work. There's a lot of work that goes into the background to make sure that the legal threshold is passed and it's in the public's interest. But it has brought our staff a lot of confidence, and it's increased the amount of incidents that we're reporting to the police when an offence, is committed by a mentally disordered offender. And I just want to take a moment to say that the work, although we are looking to prosecute people or use the criminal justice system as a deterrent. The work isn't all about punitively managing people. It's about patients having clear boundaries and acceptable behavior, and them recognizing that they can't commit these crimes on a ward when they're an inpatient will hopefully benefit them when they're in the community, and it will give them some boundaries and rules to live by. So it's a holistic approach, not just a punitive one.
So environment's really important in influencing the number of adverse incidents, and obviously design in mental health does feature the design of mental health treatment settings. So how can trust support the management of safety in the ward in the context of environment as well?
Yeah, so some of our wards are really they've been built in an era where we didn't have the understanding that we've got now about having really big open wards with lots of open spaces, access to the outdoors. Although all of our wards have got courtyard facilities, garden facilities, but those facilities were almost a bolt-on when they were designed. But now, when modern wards are designed, they're designed with the lighting and the noise and the outdoors in mind, and it's all designed to help support the environment, to make sure that people don't get triggered or they don't feel confined in. So unfortunately, we do have a lot of older wards that haven't had all these concepts in mind when they were built. So the mitigations really are looking at where we can, installing CCTV to cover a lot of blind spots, and perhaps the use of body-worn cameras. My trust have heavily invested in CCTV on the wards. Again, it's not a punitive measure. It's not a measure that's there to say Big Brother is watching you. It's about the safeguarding of the wards, making sure that everybody is safe on a ward, and it's to create a safer environment so that staff can do their jobs freely and feel safe while they're doing it.
As you say, it's for the benefit of both patients and staff. So what are your hopes for the future in terms of joint working with the police?
I think that there needs to be a more of a joined up approach still. We're still seeing on occasions where our staff will call 101 and the operator perhaps isn't aware that this is a crime and the person that's committed the crime can be prosecuted under the law, because we still hear that the operator has said that it's a mental health ward, there's nothing we can do, or it won't go any further. I think there needs to be a real top-down approach so that the management in the police are fully aware of the law in terms of prosecuting mentally disordered offenders, right down to the operators who will take the 101 call. And that joint workings, it needs to be consistent, and it needs to be sustainable in terms of, sometimes we see really good working partnerships depending on who our partners are, the actual people. So if they leave and they move to another area in the police, or they retire, then those relationships often, which were the foundation stone of that partnership, they weaken, and our partnership weakens. So we need to see some embedded policies, procedures, and really sustainable practices from the top down, so that when our staff do call the police to report somebody who's assaulted them or racially abused them on an inpatient ward, they don't get that response of, oh, what, there's really not much we can do. They get the full support of the police like any member of the public should.
But it sounds like there's a lot more to discuss, and you're going to be at Design and Mental Health on the 3rd of June, aren't you?
That's
So
right.
hopefully you can engage with people from other trusts, architects who are designing these spaces, and you can all share experiences and ideas, which is the value of coming together in one place to talk about something that everyone's really invested in. So thank you so much for your time today. As I said, you're going to be talking at Design and Mental Health. Your presentation title again is Operation Stonethwaite. The event dates are the 3rd and 4th of June. The event will take place in Manchester. So anyone wanting to come and have a chat with Santokh, please do book your delegate pass or your visitor pass at designandmentalhealth.com. Santokh, thanks again for your time. I look forward to meeting you in Manchester in June. And for everyone watching, we hope to see you at the event or at the next Behind the Design podcast. Thank you for your time today.
Thank you.